Hello dear, how are you? So today we will discuss about what is the method of psychology and how psychology relevance to the nursing. Okay. So first in methods. In methods of psychologist, it is used for the gathering the information or fact or data. So it is the introspection, descriptive research, experimental method and developmental method. Four method is there. First one is introspection, then descriptive research, experimental method and developmental method. So first we will read about the introspection method. In introspection means looking into oneself or self-observation or self-analysis. Means in the introspection means for self how we are looking and what is our observation and what is our self-analysis for the person or for the objective. So it involves carefully examine and reporting one own behavior, thought, emotion, sensation and mental note. So if we are observing one person, what is the person behavior, thought, emotion, what is their thinking process, what is their mental status. So in this method of introspection, one realize on his memory, draw in his past experience of analyzing his current behavior. How do we analyzing our current behavior, past experience for the which if any person is having any difficulty in the do their day-to-day life or any mentally illness person is coming. So how do you analyze the person? How do we analyze the self-identify that person? That is known as introspection. Next is so introspection means in the it is very helpful in the self observation without depending on time, or it does not require any device. It is the only method by which of the experience can be known. How do we find out if we are feeling unhealthy, if we are having any negative attitude, why we are having that? So for that, how we self inspect that what is wrong with ourselves. So they cannot be verified objectively, they cannot be confined by others, and repeatedly is not confirmed, and provide little or no information about the experience of the infant, mentally ill person or animal. Then descriptive research. In descriptive research, in this research, it includes the following methods such as naturalistic, case study and survey. Three methods is there for the descriptive research. So first is naturalistic observation in a natural way, means making observation into natural world of nature. So subject individualize and animal are observed in their natural world. So the observed remain unobstructive, and naturalistic observation is also used in studying the animal behavior in natural environment, and it is called ethology. So in the natural environment, what are the research is done or what are the observation is done, that is known as naturalistic. And then case study means studying individual in depth. How to means how we study case the study in particular topic, how about a particular topic we research and we take that case and study the case. One individual is examined and intervensively to find out as much as possible about certain problem or issue as it is relate to that person. So it is most often used to investigate the abnormal behavior. If any abnormal behavior is there in the case study, we can find out, because in the case study, what are the things, if theory is there in book and we comparing the theory to the practical, to the patient or to the client behavior, and biological data, source and physiological test and information obtained in the extensive and interview are the measure of the case study or case history method. So in this the case study, how first we case study, in case study we collect the history. After the history collection, we can study the case and what are the sign and symptom, what is the cause of that. After that, we can study the case. Then survey. In the survey means we are asking for response to interview or questionnaire. What like the survey? Survey means it collect information about the behavior and the any if any project is there, we are taking the opinion, attitude, life experience or personal characteristics we are taking. So survey are commonly in the form of interview or questionnaire. So question in survey should be clearly word free from bias. So due to financial constraint, research administrator survey one sample of people who represent the target population. We are select a group and we are to select our target of population, and this target we are doing our survey. So sample for the population should be representative of entire population. It is best achieve the term of random sampling, that is known as survey. Then next is experimental method. In the experimental method, it is established and caused by the effect of relationship. In one case, we are doing our experiment. So cause effect relationship can be established by experimental method. So in laboratory research, control the condition and measure the relation among variable. So a variable is something that can occur with different value. So independent variable and dependent variable, two variables is there. So in the most of the, if we are doing experiment, so we are having some variable. Without variable we cannot do the experiment. So independent variable and dependent variable is there. So next is developmental method. How do we develop our growth? Means observing the period of growth. In this, first we experiment. After the experiment, what are the lack is there, how do we develop? In this phase we are develop the client. So use in the field of developmental as a developmental psychology. So psychology, physical, social or moral, language, emotion are observed in the children. If any kind of we are observing one children, what are the things they are lacking, so after that we are giving them knowledge and they are learning and develop their knowledge. So developmental method use the following technique: normative investigation, longitudinal study and cross sectional study. So normative investigation means it describes something that is characteristics of the specific age. According to the specific age, the normative means normal things is there going on. So these observational periods norm, it come under the normative investigation. So example of normative investigation is Bayes scale of infant development. How the infant is developed, according to how we can assess them, how we can measure them, means before 6 months the infant is developed that much, after 6 months there that much, how to we can measure it, that is known as normative. Then longitudinal. In the longitudinal, in this study, change in the same individual or group are studied over a long period of time, and it is research observed for changes in the specific characteristics such as language, personality or intelligence. In a long period of time, in a long chain period of time, what are the things we are learning period to period or day to day time, that is known as longitudinal study, such as language, personality or intelligence. These three things we are doing learning in a long period of time, that is known as longitudinal study. So next is relevance to nursing. How psychology relevance to nursing means how psychology related to the nursing. So physical and mental well-being of a patient depends largely on the nurse, because physically and mentally, if the person will not come for the treatment, for treatment, so the person will not develop. So the physical and mental well-being all are depend upon the nurse, because because they are providing psychologically support, they are giving some knowledge about them. So a nurse should know the signs of behavior for better result to deal with the patient. So nurse should know about basic signs of behavior to deal with the patient. So psychologically explain the relationship between the psychological stress and physical disorder. If any kind of physical illness is there, so psychological stress also is there. So how to the person will deal with them, that also will deal with the nurse. So after detailed study of the psychology, nurse can apply the principle of psychology in the dealing with the patient. So psychology help the nurse to accept the individual differences in term of liking, disliking, emotion and response to stress. Psychology, when the nurse will study the psychology, it will help the nurse to handle the individual person, like what is the person like, dislike and emotion, and what are the stress level is there, how do they handle it, what is the response of that. Hmm. Then psychology also contribute in many therapeutic measure like behavior therapy, play therapy, psychoanalysis therapy, and more therapy, music therapy, and electro ECT. These all are the therapies. They are morely contributed in a therapeutic measure. Which about the which client need the therapy. Whichever when one person is coming to the hospital about having some sign and symptom of mental disorder. So first we assess the person, then diagnose, then treatment. At the time of treatment, if the person will need the therapy, then the therapy will be provided. So psychology help to understand the concept of self-awareness and self-esteem. So it describe the coping abilities, defense mechanism used by the patient, and this relevance to disease condition. So these are the point how psychology is related to the nursing. So today that much. If you are having any doubt, please comment, and for more video please like and subscribe my channel. Thank you.